How much did Cindy cook for you?
Well,
All right, Cindy,
when
look,
I
Cindy. Okay, you can stop. You can make it stop. You can.
Before I go, I want you all to remember that the only stroke to use with toast bread is the butterfly. Tonight, I have a very special guest. She is a Cuban born Guyanese, a mother of 5, a doctor, a clinical dermatometrist. Is that I say it right? I can't have on my glasses. I should have it on, right? She's a clinical densitometrist. I got it right. See, I needed my glasses. And a medical herbalist. Dr. Asante Blanc. How are you?
I'm fine. Good night.
Welcome.
Thank you.
Dr. Blanc is also, she's the current chair of the board at the Trinidad and Tobago Cancer Society. We're so happy to have you here tonight. How are you?
I'm good. I'm good. Thanks for having me.
Nice. Thanks for joining us. So we hear you see I'm in my pink.
I noticed.
I'm in my pink.
Yes.
Yes. So that's what I want to start with. Well, first tell us a little bit about yourself. Tell us something. Anything.
I'm just like every other woman, you know. I am a mother.
Confused? Okay.
Yes. Confused. No, I'm a doctor. I'm an integrative medical practitioner, so I bring both the Eastern and Western branches of medicine together. A wife, a mother, a friend, a sister. I'm just a normal person. I love what I do. I like the idea of spreading the education in terms of health. I like bringing together everything so people can achieve optimum well-being, just regrouping and readjusting, and not only thinking about medicine and stuff like that in terms of drugs. And I love, well, my passion right now is obviously towards cancer. That's my give back, because I lost someone very dear to me.
Yeah.
To cancer, and so that's my give back, and that I've been doing it for years, and I enjoy.
And we thank you. And we thank you. I think most of us can relate to having lost a loved one, to cancer. So tell me, I am wearing pink, and a lot of people wear pink for the month of October. But I don't know if people know, the origination of why we wear pink, what it means. Tell us a little bit about that.
Yeah, you made me go and research it.
Really?
And I was like, why is she coming with this question? And I said, I have no clue, because we have a calendar of cancer. And
Right.
we know pancreatic cancer is purple. We know lung cancer is this. We know pink is for breast. And I must say, I was like a real sheep just following the flock. And I was like, damn, now she asked me this question. I need to go find out. So I went and I looked it up.
So tell us.
So I found out that in the 90s, there was a woman called, and I have to get her name right. So her name was Charlotte Haley, and she came after Susan G. Komen, and they were cancer survivors. And they were doing this thing where, trying to get funding in the United States, federal funding for breast cancer awareness. And Susan had thought of this ribbon thing with pink, and then Haley took it up. But it didn't catch on until the magazine, and wait for this, the magazine Estee Lauder magazine.
Right.
Yeah, so you had me going through this.
You are welcome. To the listeners, you are welcome. You see
I
what?
was grateful to you. I said, I must thank you, because you made me realize my ignorance. And so anyway, so they made this pink ribbon popular. But then it got even better. I said, but why would they choose pink? And people thought that it was because pink was for women, feminine. But it wasn't. It's supposed to be that pink apparently represents life affirming, calming, playfulness, quiet, and stress relieving. And so
Okay, when
this
I
would
see you wearing this color, I'm none of those things.
no, but your comedy alone does that. So you
Okay,
should,
okay, good, good, okay, good.
but it's really about empowering women, and I love the fact, and I'm so happy you did that, because this year, for example, the Trinidad and Tobago Cancer Society is 50 years old, and we are celebrating survivorship.
Right.
And I think it's amazing that that's what pink represents.
Yeah.
Because it's really all our survivors. I mean, you speak to them, and those are the words you hear, getting calm, affirming the affirmation, I'm going to beat this, I'm making this,
Yeah.
the positivity. So I was actually quite grateful to you for making me do some research.
Yeah, thank you. Because we, like you said, we sometimes just follow. We see pink and we go and we get our nicest, pinkest outfit, but we have no idea the meaning of it, and I think it's important. So, thank you as well. So let's move along. So tell me, what? So I'm going to ask you this: what is cancer? And I want you in your response to kind of highlight breast cancer, what the causes of breast cancer, and the stages of breast cancer.
Lord, I saw your questions. I thought she was coming for me,
Yes, we want to know. We want to know.
So cancer, basically, I like to tell people, cancer, you have to think of cancer as bad behaved cells in the body.
Okay.
So every cell in our body has a programmed time to die. It's called apoptosis. So we always use the classic example of a red blood cell that dies at 120 days. Spot on. And that's due to our genetic machinery, our DNA, and it's all programmed. So everything we do is actually programmed in our DNA for every cell. Every cell in your body functions based on the DNA and the environment in which that cell is in, and the DNA is dictated, and it does what it has to do.
Right.
So your breast cells, so you have breast tissue, your mammary glands. So what happens is those cells, sometimes we have genes. So they're genes. So you've heard of the BRCA genes, the BRCA genes. So those genes are the breast cancer genes that we tend to look for in women in terms of family history, and men as well.
Okay, yes. Okay, yes.
So those genes can be turned on and off in a human being. So it's all through DNA machinery. So I don't know if you remember the old typewriters.
Not well, no.
Not well. Okay, well, you could pretend I do. And you remember the ribbon. So you remember when the ribbon used to lose the ink? And I think our viewers are too young, but they need to Google that. When the ribbon used to lose the ink and you used to press S, but you used to see A, U, and T all over because you'd used the ribbon so many times.
Right.
So think of your machinery that's making the different proteins in your cells, especially in your breast cells, and the machinery, because we're living much longer as well, Cindy Ann. And so it's faulty. So different things can cause faults in that machine. And therefore the breast cells, they don't die when they're supposed to, and they grow out of control and may have function. And that in a nutshell is breast cancer. So you have internal risk factors or internal factors that can affect the machinery. And factors.
Okay. And so tell me quickly, because we have a packed program. So the stages, right? So tell us the stages of cancer, because I know there's stages 1 to 4, at least.
Yeah.
I don't know if there's
0 to 4. So
0 to 4.
Non-invasive, right? In situ, DCIS, and then you go 2, 3, 4, and then they each have the A's and the B's. So what it, as the cancer is spreading, you go up in stage. So stage 4 is when you have, metastasis, which is spread from local, it has distant spread. So cancer likes to go to the brain, the bone, and the lungs. Yeah? But it can go all over. It can go to the liver, it could go all over. So 4 is when it's metastasized, and that's invasive cancer. From 2 to 4 is invasive cancer.
And that's when you have to take all measures to just try and do.
You need to take all measures before.
Good. I was hoping you say that. That was good. You went straight into it. You fed into it. That was good.
You're not catching me tonight.
Right. I come out straight tonight. So let's go. So, usually when we speak about breast cancer, we highlight women.
Yes.
it's everything is woman and breast, but we know well, most people or some people know that men also get
Breast cancer.
breast cancer as well. So at what age should men start doing self-examinations, and what does it entail for them? You know what I mean?
So it's a good question because breast cancer in men is actually quite rare. It's about
Mm-hmm.
1,000 in the US, and in the Caribbean it's even more rare. So men have to know their family history. So they should know if the women in their family have propensity to breast cancer or have had a lot of breast cancer. That's number one. If men have what we call gynecomastia, which is sometimes you see men with what looks like breast, man boobs.
Yeah, yeah, yeah.
So if they have that, that's a risk factor. So they definitely need to check their breasts and self-examine their breast to see if there are any lumps, right? And
Mm-hmm.
cases we can actually do mammograms if men have a lot of breast tissue. We can do mammograms on them, right? But it's very rare that we would do that. Most times they don't have a particular age like us.
Okay.
They have to be conscious of their bodies, and they have to, when you're bathing, you'll feel a lump, and they will tend to feel it a little more easier, dare I say, because they'll have less than us. You
Let's.
understand?
Well, when you say us, I mean,
Okay, right. I
yeah,
remember you now, right?
yeah, when you say us. So, no, but that's good because, like I said, a lot of guys think, that can't happen to me, so people need to be aware that it can
and,
happen.
and they need to be aware because cancer is a lifestyle disease. And
Correct.
therefore, this is where it impacts everybody in society based on our lifestyle, what food we put into our bodies, how much alcohol you drink, smoking. Cindy, I didn't say no alcohol. I said
All
how
right.
much.
Okay. Okay.
Yeah,
Okay.
I was
All
very
right.
cautious here. So I saw your face just drain, like, oh my
Like
God.
what?
Yes.
Yeah.
But and physical activity, exercise, stress coping, proper sleep. So I think it's important for everyone to be conscious about it and to really listen to their bodies. And often you're hearing stories of people who don't listen to their bodies and are fearful of the word cancer. And this, I think people need to be empowered that you can be so proactive through screening that you can actually survive cancer, and in this case, breast cancer.
So that's good because that leads me to our next question. How accessible and affordable is it? Because you're saying that people should, they should screen and they should, it's something that you could control, but how accessible and affordable is it for us to get
In,
screened?
in Trinidad,
Yeah.
the Trinidad and Tobago Cancer Society has really been breaking the barriers to access to these services across Trinidad and Tobago. What does this mean? Through the support of the Ministry of Health, as well as corporate TNT and our own fundraising ventures, we've been able to keep the cost very low. You
Good.
understand? So it's very easy. Once you know that you have to get screened in terms of your mammogram and your breast ultrasound and your clinical breast exam, then it's very easy for you to access through the Trinidad and Tobago Cancer Society. However, I must let you know that you can also access through the public system. I mean,
Mm,
it's easy, and especially with COVID, but there are mammograms in the public healthcare system, and
good.
then other private institutions that do have mammograms as well.
Yeah, because usually that's what probably some people is fear, but there's also that financial aspect where they're like, look, I can't afford it, So, but it's
So
good to know.
sector, which is free,
Good.
and Trinidad and Tobago Cancer Society, which is the lowest costing procedure. So I want people to understand that this is not a Confucius situation where cheap thing not good, good thing not cheap. We actually
Right.
state of the art equipment matching everybody in the country. So we make sure that you understand that we do our best to excel when it comes to screening, especially with breast cancer, because that's what we're speaking about. So don't make that an excuse. And we have, so I mean, like we just had a offer 2 for 1. So women came in and got 2
I
mammograms
saw something about that. Yeah. Yeah.
$300.
Yeah. You
Paid
see?
paid 150 a mammogram. So you can't deny that we're trying our best to break that barrier, break through the
Good.
barriers.
So yeah, and we appreciate it. So what I want you to do now is tell us where people could
Somebody just wrote to ask. You should ask me to laugh, and I know the person, and that is why.
Oh, Amanda, you see, Amanda come here to disrupt the flow. We're not taking her on tonight. She had her time. You understand? She had her time. So tell our viewers where can they find like a comprehensive list of gynecologists, urologists, oncologists, or even where they can go for testing. So just very quickly, because we have to wrap up.
So for anytime you're talking about breast health, you can go to your family doctor, because your family can do your clinical breast exam. If you are looking for a specialist or even a reputable doctor, you go to the Medical Board of Trinidad and Tobago website, which is tt.org, and you will find a comprehensive list of all the doctors that are registered in Trinidad and Tobago. Yeah.
Okay.
That's where you'll find us. And I mean, you can ask your doctors, there's so many ways of asking.
So what we could probably do as well is to get that list from you and put it on our Facebook page. That'd be good. Yeah.
I will give you the website for the medical board. It's a lot.
Good, perfect. That would work. So we have thank you. And before I leave, I just need to clear this up. Curry chicken or chicken curry?
It depends on where I am.
Wrong answer.
Do you know you made me? Everybody asked me that, but I'm a cousin to saying chicken curry, right? And curry chicken. So that's. I don't know. It's like I never thought of it until y'all pointed it out to me. To me, I always used to say curry chicken.
Yes, that's what it is. Not chicken curry, it's curry chicken.
But when you're going to the country in Ghana, it's chicken curry and it's duck curry and it's goat curry.
We'll sort them out. We'll sort them out soon.
You leave them right where they are.
Asante, thank you so very much for joining us. And I hope everyone was able to get from this so much information and they can go back and look it up. And I hope you join us on Sunday for our fundraiser.
I will, as long as I remember, I will. Yeah. And if anybody needs information from the society, you can find us on Instagram, Trinidad Cancer, and on Facebook, Trinidad and Tobago Cancer Society. And we're there, and there's so much information. And please, and we, anything you need, you contact us, and we'll try our best to help you.
Thank you so much. So here are guys, contact the Trinidad and Tobago Cancer Society for anything you need except curry chicken or chicken curry. Right?
Yeah.
Bye. Thank you so much. Have a good night.